All right, next we're going to talk about postpartum. In the postpartum period, the uterus contracts to prevent hemorrhage, and over several weeks, it decreases back to original size, and that process is called involution. We also see diuresis. Remember, the blood volume increased by 50% in pregnancy. Diuresis reduces it back to normal, so they're going to have a lot of urine output in the first few hours. Lochia is the bloody discharge that we see in the postpartum period. It actually has 3 stages. In the first few days, it's mostly red and it's mostly blood, and it's called lochia rubra. And then it changes from pink to brownish after 2 to 3 days. Then it's lochia serosa. After a couple of weeks, they'll continue with what they call lochia alba, which is yellowish to white, and it's more white cells and things. So it gradually changes and then goes away. Postpartum, the patient will also have breast changes in preparation for lactation. They'll have increase. It starts with increased lumpiness and soreness, and then the breast may get very, very firm, even hard, with engorgement. Once the milk comes in, that discomfort and swelling decreases. Engorgement is more swelling than milk. Once the milk has come in, that swelling goes down. There's an increased risk of DVT and PE in the immediate postpartum period. So those patients need to be up moving, and we need to be assessing them. There are changes in family structure, and we've got to help make sure that or help them with the bonding process, or at least assess the bonding process. Care for a postpartum patient. If you ever worked in postpartum, it's about 95% monitoring and about 5% what you're monitoring for. In stage 4 labor, which is the beginning of the postpartum period, we're doing vital signs and assessing fundus and lochia on the same schedule we would a postpartum or post-op patient. Every time we do vital signs on a postpartum patient, we also check fundus and lochia. We also need to be assessing their breast, assessing for DVT, helping manage pain, encouraging mobility, encouraging bonding, teaching about self-care and care for the baby, and address their contraceptive needs before discharge. Okay. In the next section, we'll talk about postpartum complications.